All right, at this time, we will turn it over to you, Miss Emily. Emily joins us virtually from the Hospital Council of Northwest Ohio. And I know she's going to have some opportunities and some breaks during her presentation where you'll be able to ask questions, but we are going to have to use that microphone so she can hear you clearly. So we will be around to bring that microphone to you if you need it. Emily, it's all yours.
Perfect. Hello, everyone. My name is Emily Gensler. I work for the Hospital Council of Northwest Ohio. I've been with HCNO for about 6 years now, and I'm the project manager for the 2022 Delaware County Community Health Assessment. I can only see Kelsey, but I'm glad to be here virtually with you all today. So thank you for being here. This report provides an overview of health-related data for Delaware County adults and parents of children 0 to 11 years old who participated in a countywide health assessment survey. This was actually administered from September to November of 2021. The results are based on a self-administered survey using a structured questionnaire that was created by partnership members. Additionally, youth data was collected in 2019, and we also incorporated that into the full report. Unfortunately, 2019, we were in the midst of the COVID-19 pandemic. So during that time, we never had a full formal release of the youth specific data. So we'll be touching on the youth portion of the health assessment as well today. So pretty jam-packed with both adult, youth, and child data to cover today. So the purpose of this PowerPoint presentation, I will explain the design and methodology of the community health assessment before we actually dive into the data today. And then we will go ahead and share a snapshot of data from each individual section within the full report. Okay, so I wanted to start today by looking at the top of the slide. You'll see the organizations that funded the 2022 health assessment. And then the Partnership for a Healthy Delaware County, or the Partnership for short, commissioned the health assessment. This report would not be possible without the collaboration of all of the partners on the next few slides. This group came together to develop the questionnaire for the health assessment, reviewed the draft data, and then assisted us in finalizing the full health assessment. And this is our last slide covering the partnership members. So again, thank you so much for all of your involvement throughout this process. I would like to also acknowledge the work of the Hospital Council of Northwest Ohio. The Community Health Improvement Division, which is where I work, was responsible for project management, data collection, secondary data collection, as well as the full report development. For those that are unfamiliar with the Hospital Council, or we call ourselves HCNO, the Community Health Improvement Division actually first worked with Delaware County in 2016 to analyze the data from the Youth Risk Behavior Survey. And then we also worked with all of you in 2017 to complete the Adult and Child Health Assessment, which was the most recent report prior to the current one. HCNO is based out of Toledo, Ohio, and we are a regional hospital association that represents and advocates for our member hospitals. And then at the bottom of the slide under acknowledgements, we also work with the University of Toledo, which you will see Joseph Dake listed. He is our statistician who oversees all of our data collection. We also have 2 additional consultants at the bottom of the slide as well. Okay, so now switching gears a little bit, I'd like to share some information regarding the methodology of the full health assessment. First, looking at the design. So in 2021, as mentioned in a previous slide, the partnership did come together to determine the content of the surveys for both the adult and child populations in Delaware County. The group reviewed master questionnaires to determine what questions they would like to incorporate within the full survey. It is important to note that a large number of questions came from national sources. So you can see some of those acronyms there under instrument development. So many of our questions are actually coming from CDC specific questions for the adult and child populations. You will see NSCH, which is the National Survey of Children's Health. And then the ones prior to that are both from the CDC. Next, I will share the biggest part of our methodology, which is the procedure in which we actually collect the data. So for this specific area, I'm only talking about the adult and child data. So for the adult and child assessment, we actually sent a mailing to Delaware County residents. It's always interesting to see who from the committee was chosen maybe to receive the survey. We actually retrieve addresses from a company called Melissa Data out of California. And anyone with a valid governmental ID can be chosen at random to receive the survey. To give you an overview of the quantity that we send out to your community, we send out 2,000 surveys to the adult population, and then 5,000 surveys to parents of children 0 to 11 years old. So this mailing campaign that I'm referring to, as you can see under the adult and child procedure, has actually two parts. First, we send a letter to the resident to let them know that they may be randomly selected to receive a survey in the mail. And this letter really explains the purpose and the importance of the community health assessment. Additionally, this letter was created on county letterhead and then signed by local leaders of the partnership. And then 6 weeks following that first mailing that I just spoke about, the same group then receives a packet in the mail, which then includes a letter explaining that they were randomly chosen to receive the survey. It includes the actual survey that was created by the partnership, and then a $2 bill as an incentive to complete the survey and send that back to HCNO. We do include a postage paid envelope, so there's nothing that they need to do other than put the survey in the mail, and then it comes back to HCNO to analyze. The letter and survey both explain that the survey is anonymous and there's no way for us to know or track who's sending the survey back to us. And then on the next slide, we'll explain how many surveys we received back from each population, and then talk a little bit more about actually analyzing the data. But before we move on to the next slide, as I mentioned earlier, of course, we did also have youth data that was incorporated into the presentation as well. This was collected in 2019, and then students were surveyed via an online platform in public school districts in Delaware County. And when we cover the youth data, that will be specifically looking at 6th through 12th graders. So as mentioned on the previous slide, we sent out 2,000 surveys to Delaware County adult residents, and we actually received a total of 464 surveys back with almost a 25% response rate. I will say this is very, very high compared to other communities that we work in across Ohio. We're seeing anywhere from 10 to 15% response rates this year. So just an amazing response from your community there. We do run a power analysis, which tells us how many surveys that we need back to actually generalize the results to Delaware County. Our power analysis number was 266 surveys. So that's how many we needed back to generalize. And then we received, as I said, 464. The CI with the plus or minus sign is showing us our confidence interval. So any data point that you will see in the report, we're 95% confident that the results are in that range of 4.54. Right now, we're aiming for 6% in most communities that we work in. So anything under that 6% is wonderful, and that's what we aim for. And then similar to the adult response rate, we received a much higher number back than we needed to generalize also from the child population. You'll see that power analysis number that I previously spoke about was 265, and we received back 438 back from parents of children ages 0 to 11 years old. And lastly, for the youth survey, there were 31,350 youth ages 10 to 19 who participated in the survey, which is just awesome. You could see the breakdown of middle school students as well as high school students. And then again, our power analysis number was 266. So our margin of error is just awesome when we look at that representation of your community. Okay, so this is the last slide for our methodology, first touching on data analysis. Dr. Dake, yes.
Emily, real quick, Kelsey wanted to talk to you.
Absolutely.
Emily, could you just go back one slide for me, please?
Yes.
I just wanted to clarify on the youth survey, that first bullet, 31,350. That wasn't how many youth participated, but how many youth lived in our county. Is that correct?
Absolutely. Yes. I'm so sorry. I misspoke there. The end number is 13,907. I am so sorry.
That makes sense. So,
Thank you for clarifying, Kelsey. Okay. So back to our methodologies, the last methodology slide. Our statistician, Dr. Dake, analyzes the data using SPSS 26.0. And this is a statistical software program where he is able to weight the adult data so it's as accurate as possible to match the demographics of Delaware County. Just as an example, if the data came back 60% female and 40% male, and Delaware County's population really is supposed to be 50-50 there, that is taken into account when he actually weights the data. We also have limitations, of course. There's always limitations to survey research. First, our adult and child data collection is self-administered via written surveys. The CDC actually still collects data differently in the sense that they still use telephones to collect data. Also, the data is self-reported, so we always have to remember that it's not coming from actual medical records, but people reporting their actual health themselves. And lastly, under limitations, caution should be used when we're breaking down the data into further categories, because of course, every time you do that, it is a smaller sample, and then that margin of error is higher than the full population statistics. And then before we move on, we also have an institutional review board out of Maryland, and they oversee our methodology, review our surveys and the letters that go out to each community, and just overall ensure that we're doing good research. And additionally, IRB approval was also granted to Delaware Public Health District for the youth process within the schools. Okay, so before we actually jump into the adult data, I wanted to touch on the adult demographics before we get into each individual section. And this really is giving you a general picture of the respondents' demographics. This first one is looking at race and ethnicity, which we had the majority as white at 89% of respondents. As you can see, Asian and Black or African American were both at 3%. We also had 1% Hispanic and 2% other. For marital status, the majority of respondents were actually married at 67%. You can see 15% were also divorced or separated. And then for our education category, most had some college or a college degree, and 12% had a high school diploma, and then 2% less than a high school diploma. And then lastly, we have our income categories. So this, I always like to note here, is household income, not individual income responding to the survey. And then we can see about half at 50% were falling into the $100,000 or more household income. And then we also see about 18% falling below $50,000 for their household incomes. Okay, so that is all I had for our overview of the demographic categories, as well as an introduction to our methodology of the full health assessment. I'll send some reminders as we go on when we transition to the youth data as well as the child data. But this is really our first large section within the report. covering all of the individual sections that you see on your screen here, which is health behaviors. And the full report is over 200 pages. So we will definitely not be covering every single data point that you will find in the full health assessment today. But of course, please feel free to dive further into the report after today's presentation if there's anything you're interested in learning more about regarding the specific sections. So the first section we'll review today is health status, but I did want to pause prior to moving on to the youth and child data since it is a lot of data to get through. I definitely realize that. Feel free to write down any questions you may have as we go through, and then I'll pause after we finish the adult portion before moving on to the youth health assessment. So before I move into the health status section, is there any questions regarding that beginning methodology before I move on?
They're good.
Okay, awesome. Thank you. Okay, so to explain the graph a bit before we dive into the data, we have adults on this slide reporting out their general health status. So we have categories as excellent or very good, good, and fair or poor. You will see the darkest color is representing excellent or very good, and then the lightest color at the very top is representing fair or poor health. So you'll see our highest percentage for fair or poor health is for those with incomes under 50,000, again, household incomes. And then we have many categories listed in the graph that you will also see in other graphs as we move on throughout the presentation. So the first column, which you can see labeled total, is that total percentage for the 2022 health assessment. And then we also move into gender, age categories, and then household income categories. And then at the bottom of the slide, you can see our comparison table for our main indicators. We include data from previous Delaware County health assessments, if applicable. And then we also have Ohio and US data to compare ourselves to on the very right-hand side of the table. So both coming from the CDC for our Ohio and US comparisons.
Emily?
Yes.
Can I interrupt for just 1 second?
Absolutely.
The bottom table with our optics, we can't see that full table.
Okay. Is it cutting off at a certain point?
There we go. Yep, now I can see it.
Okay, perfect. I'll just
Hold on.
pause before we move on.
Where did it go? There we go. There we go.
Okay, perfect.
And folks, if you are interested in looking a little bit easier, if you want to move your seats up to the front, feel free to rearrange at any time.
Thank you, Kelsey. Okay, so our next slide under health status is looking at those who struggled to afford prescription medication within Delaware County. And then specifically, this is looking at within the past year. You can see those with household incomes less than 50,000 had the highest percentage here that struggled to afford prescription medication at 12%. At the very top of your slide, you'll also see the overall percentage of those who said they were taking at least one prescription medication, which increased by 20% for those 65 and older. Next, we have our weight control and physical activity section with 71% of adults falling into the overweight or obese category. And this is actually measured by BMI. We do have questions within the survey that does ask height and weight of the respondent. And then we did see increases in those considered overweight since the last 2017 assessment. So looking at that table at the bottom of your slide. And then Delaware County did have a lower percentage of those considered obese than the state percentages, which was at 36%. Our obese percentages are depicted in the darkest color within this graph. So at the very top, with the highest percentage being in the lower income category under 50,000. As you can see, 59% were considered obese within that category, which is definitely different than the other income categories. Our highest income category was at 26% as that general obesity category. We also see some large differences in those who are considered overweight in the gender category as well, with males being more than 20% higher than females. We also have some physical activity information on this slide. 40% of adults were engaging in physical activity at least 30 minutes, 1 to 3 days per week. And then at the very bottom there, we have 10% not participating in any physical activity within the past week. You can see this changed by a few percentage points since the 2017 assessment. Moving on to diet and nutrition, we have some fruit and vegetable questions, as well as those eating out in a restaurant or bringing takeout food home at the following frequencies. Most were indicating 1 to 2 meals per week at 63% of adults. And then for that fruit and vegetable intake, the highest percentage was in the 1 to 3 days category for those eating 5 or more servings. That is specifically whole fruits and vegetables. Next, switching gears to the tobacco use section, we can see overall a continuous downward trend for those indicating that they were current smokers. Specifically, current smokers is referring to cigarettes. So as you will see, Delaware County is far below the state and nation here. In 2020, we have 19% of those in Ohio being considered current smokers and 16% in the US. So Delaware County is at 6% here. And then we also have some e-cigarette electronic vaping product usage. It is pretty low here with 96% saying not at all. But of course, we'll see some changes that you probably won't be too surprised about for the youth population, which definitely is higher here than the adult. Here is our overall percentages for current smokers, former smokers, and then those who have never smoked. We have the highest percentage here of current smokers being in the lower income category at 11%. Next is our alcohol consumption section, with 33% of adults being considered binge drinkers in the county. You will definitely see a spike since the last assessment in 2017 from 22% to 33%. We are seeing increases here for many of the communities that we are working in. Of course, could possibly have a relation with the pandemic, with many adults saying that their alcohol consumption has increased. So you'll see some data on that coming up in our social condition section. And you will see the definition of a binge drinker in that comparison table at the bottom of your slide. Additionally, we had 1 in 5 trying to reduce their alcohol consumption, and then 5% were told or they were personally concerned that they had a drinking problem. You will see quite the difference here for gender for binge drinking, along with age as well. The 65 and older population definitely has the lowest percentage of binge drinkers in the county. And then we also had the income category. We can see those with higher incomes being the most likely to binge drink within the county. Okay, so next we are going into the drug use section of the report, with 9% using recreational marijuana in the past month. And then we also have a graph at the bottom of your slide matching that indicator here, with the under 30 population, definitely the highest subset using recreational marijuana within the past month. We also have prescription medication use within the past month, as well as other drugs, for example, cocaine, heroin, etc. 7% of adults had used a program for either alcohol or drug problems. And you'll see within this bullet, this is not just for themselves, but it may be for a loved one as well. And then we ask why they did not seek a program or service. You can see some different options here listed, with the top reasons being copay or deductible being too high. They were embarrassed or ashamed of seeking services. They could not afford to go, as well as fear were in our top 4 responses here. Okay, switching gears a bit now to the next section, which is sexual behavior. This graph depicts the number of sexual partners Delaware County adults had within the past year. The middle, which is the lightest color, shows more than one partner, with the highest percentage being those under 30 years old at 8%, as well as those with incomes less than $50,000 at 9%. Okay, so our last section that actually falls under health behaviors is the adult mental health section. Our very first bullet, we have 19% of adults being reporting that they had been diagnosed or treated for a mental health condition. You will see the largest increase here within that sub-bullet for those under the age of 30. We also had a new question asked this time around on the survey, and it was surrounding mental health care via telehealth services. So many of our communities have started asking this question as telehealth is becoming more and more popular. And then among those who are using telehealth services, 12% felt it was better than in-person services, 53% said it was the same, and then 26% said they thought it was worse than in-person services. On this slide, we are covering both suicide attempts as well as those considering attempting suicide in the county. We had 1% of adults reporting they actually attempted suicide within the past year. And you will see it was less than 1% in 2017, and then now 1% in 2021. And then those who seriously considered attempting suicide was at the exact same percentage as 2017. 8% of Delaware County adults reported they felt so sad or hopeless almost every day for 2 weeks or more in a row that this stopped them from doing usual activities. This was also the same percentage in 2017, so both at 8% here. And you will see some large differences here, pretty much in every category actually, with females being the highest here, doubling from males. And then also those under 30 years old, and then those with lower incomes, all were higher within the county. And then similar to the previous question regarding drug use services or alcohol services, we had 17% looking for a program for depression, anxiety, or emotional problems. Reasons for not using a program were pretty similar to the previous reasons that we covered. So those who had not thought of it, cost, feeling embarrassed or ashamed of seeking services, were all among the top responses here. Okay, I'll just do a little pause here. I know that was quite a lot to cover quickly. The next section that we will cover is chronic disease, a little bit quicker than the health behavior section, but we still are within the adult portion of the assessment. Okay, I will move on. All right, so you will see similar percentages to the last assessment across most indicators here within this slide for cardiovascular health. Actually, all indicators for Delaware County here were lower than the state, besides high blood cholesterol, which was slightly higher for Delaware County when comparing to both Ohio and US percentages. Our 65 and older population, as well as those with lower incomes, had much higher percentages here for those diagnosed with high blood pressure. And we did have the same percentage as 2017, so not changing at all here since 2017. We also have quite a lot of secondary data throughout the full report regarding cancer. So please feel free to dive further into this section for any specific cancer information that you may be looking for. 12% did indicate that they were diagnosed with cancer more than a year ago, and then 2% said they were diagnosed within the past year. You will see the highest incidence of cancer being breast cancer within the county. This is specifically coming from the Ohio Department of Health. So in that reddish pink box that you see on your screen. Next, we have asthma data with a slightly higher percentage than the last Delaware County health assessment. We are slightly lower here than the state and nation. And we did see some big differences here with age, with 30 to 64-year-olds being the highest percentage within the age categories. We also have diabetes information with the highest percentage of those diagnosed 65 and older with 18%. And then also those with lower incomes were the second highest percentage within the county. And we did see just a slight increase here from 7% to 8% in 2021. Then our last section that falls under chronic disease is quality of life. We had 19% of adults say that they had fallen in the past year. And then among those who actually fell, 18% said that their fall had actually caused an injury. And then with our second bullet, we have different types of difficulties that adults may have experienced. With difficulty concentrating, remembering, or making decisions. And that is not just due to a physical condition, that can also be mental or emotional as well. And then lastly, under quality of life, we also included some information regarding chronic pain for Delaware County adults, with the highest percentage being for those ages 65 and older, as well as, again, that lower income category under 50,000. Okay, so we have a few more slides which will cover social conditions for the adult health. We both have social determinants of health, as well as some information regarding COVID-19. Social determinants of health, I would say, is one of the largest sections of the report. So there is a lot of really good data here within the full assessment. So please feel free to dive a little bit further into this within the full report. The very first slide that we have under social determinants is covering food insecurity issues within the county. So many different issues related to food access here, with 6% experiencing more than one of those above food insecurity issues, and that is within the past year. The top issue reported was adults being worried that food would run out. You'll also see options here like food assistance being cut, being hungry but not eating because they did not have money for food. We also have those choosing between bills and buying food. We also have some information covering adverse childhood experiences, which we like to call ACEs for short. We know that those who experience a higher number of ACEs are more likely than those not experiencing any ACEs to potentially have poor health outcomes. So we actually have information regarding ACEs covering every population that was surveyed. So the youth population as well as the child as well. There are slightly different questions for each population, but we usually report out here the number of ACEs. So as you'll see at the bottom of the slide, 14% experienced 4 or more adverse childhood experiences. I will say that this is under the age of 18. So when adults are responding to this question, any of these experiences occurred under the age of 18 for them. You'll see the top adverse childhood experience was living with someone who is depressed, mentally ill, or suicidal. Relating to financial stability on this slide under social determinants, we have 6% needing help meeting general daily needs, and this is within the past 30 days. This increased to 17% of those under the age of 30, and then 16% with incomes less than 50,000. And then more than half of adults were reporting less than 30% of their income was going to their housing. The next slide covers adults who felt emotionally upset as a result of how they were treated. This could be based on any of those items that you see here listed below in sub-bullets, with the highest percentage of adults who felt emotionally upset was as a result of their skin color at 11%, and then 8% saying ethnicity. You'll see we also have culture, language, sexual orientation, disability, a lot of options here within those sub-bullets. And then our last section under the adult health portion is COVID-19. We did add a new section here with a few COVID questions. One being what impacted adults or their families' health within the past year. So we have COVID-19 impacting adults, with 33% saying it impacted them and their mental health, with a decline in mental health. We also had those experiencing educational challenges. As we saw clearly with increases in binge drinking in previous sections, we had 20% saying that their alcohol use had increased because of the COVID-19 pandemic. And then we also had those who were told by a doctor, nurse, or health professional that they had COVID-19. We had 14% of respondents say so. And then we also had those who were fully vaccinated against COVID-19 within the graph on this slide. We do have a note at the bottom of the slide with the wording that was included on the actual survey. So adults could report if they were considered fully vaccinated, partially vaccinated, or not at all. And then we had our highest percentage responding under 30 years old. Okay, so I'm going to go ahead and pause again. I know that is a lot of data to go through. Our next section we will be covering and switching gears to is youth health in Delaware County. So if there's any questions about the adult portion, please feel free.
Is there anything that you'd like to revisit or have her review before we switch gears to a different population? Don't be shy. Go ahead. The question, Emily, was where does Delaware County mental health statistic for adults, is that right, compare with the national statistic?
Sure. So as you probably saw, we usually have comparisons for the US and Ohio within each slide if we do have that data, but unfortunately, Ohio and US CDC questions, they do not ask those same questions for us to be able to compare to, unfortunately. As I kind of touched on a little bit in our methodology, since the CDC does ask questions via the telephone, there are some questions that are a little bit too sensitive for them to be able to ask. So for example, sexual behavior questions, mental health, as well as drug use, we do not have those national comparisons. I can say though, working in other counties throughout Ohio, I would say that Delaware County is very similar with those who reported that they contemplated suicide, attempted suicide, as well as those depression indicators, I would say are very similar to other communities that we work in as well. So I hope that answered that question.
And I was going to share this at the end, but this just goes to show for any data point. We know that this is a ton of data this morning, broken down a lot of different ways. I'm going to go over where you can find the data at the end of Emily's presentation. It is on our website, but we do have staff availability that if you are looking for a specific data point to be cross-tabbed or broken down in a different way than what's reported in the report, we do have an epidemiologist with us on staff that will be able to manipulate that data if you are looking for something. So that's what we do in community health. We get you what you need. So if there's something specific you need, we're an email away. Any other questions? All right.
Okay, thank you, Kelsey. All right, so we're switching gears to cover an overview of the youth health in Delaware County. As mentioned in the methodology portion earlier in the presentation, this is covering 6th through 12th graders in public school districts in Delaware County. And this is an overview of the different sections that you will see on this slide within the youth report. We will first start with weight status and physical activity. Again, there's a lot of data within each individual section. So if there's a topic you're more interested in, please review the full report. Okay, so similar to the data in the adult portion of the health assessment that I started with, you will see some age breakdowns here for BMI. The way that we break this down is 13 or younger, 14 to 16, and then 17-year-olds or older. You'll also see the gender categories as well. Those who were obese were highest among the male population when compared to females, and then also highest for those 17 and older regarding those specific age groups. About half of females reported that they were trying to lose weight. And then to lose weight for the general population, youth were reporting exercising, drinking more water as the top 2 ways that they were trying to lose weight or keep from gaining weight in the past month. You'll also see options towards the bottom of the list, such as smoking cigarettes, vomiting, going without eating, and skipping meals. So you can look at the comparison tables a few different ways. I know this is pretty overwhelming to look at, reporting out on all of this data. So we can specifically look at middle schoolers, which is on the left-hand side of the table that you were looking at. You'll see at the very top in gray, we depict middle schoolers. And then on the right-hand side, we have high schoolers in 9th through 12th grade. The green color is pointing out the overall sample of 6th through 12th graders. So again, a few different ways if you're interested in looking at some of the trends here. If we are looking at high schoolers, we have comparison data for the US on the right-hand side. And lastly, we can see the information comparing to previous Delaware County data. So we do see some very similar percentages for those who are considered obese or overweight for high schoolers. And then we were well below the US rate in Delaware County here at 9% compared to 15% for the US. Okay, so this slide primarily covers physical activity, so some more comparisons as well. The third row includes those who did not participate in any physical activity in the past week, which actually declined for high schoolers with a percentage much lower than the state as well, which is always good to see. So from 10% to 8% for high schoolers in Delaware County. Our next few slides will cover nicotine use, and we specifically on this slide have information regarding e-cigarettes or electronic vaping products, which definitely grew in popularity when we collected this data in 2019. So you can see what type of substances youth were putting in their e-cigarettes in the past year, with about 1/4 reporting marijuana or THC in their e-liquid. We also have information regarding how they were obtaining their electronic vapor products. So mainly borrowing them from someone else at 40%. And then here's a breakdown of the current electronic vapor product users, with the highest percentage here being 17 years and older at 17%. And whenever you see, before I move on, whenever you see that current use, the CDC defines that as past 30 days. So if the respondent reported that they used this within the past 30 days, they're considered a current user. Okay, so moving on to some more nicotine use questions. We had 15% of youth trying nicotine products at 10 years old or younger, and that does exclude electronic vapor products, and then another 17% by 12. And then at the bottom, you can see the different forms of nicotine they used in the past month, which all being 1% here, besides our electronic cigarette use. When looking at our comparisons with the national data, we do have a lot of similarities across the board here. The biggest differences, youth considered current smokers, which actually declined since 2016 in Delaware County to now only 2% of users. So just like the adult data, we do see declines here as well. And then this is far below the national percentage at 9% for the US. As you can see, before we move on as well, we have also current electronic vapor product usage with declining actually since 2016, and then still lower than the US percentages. Okay, so moving on to alcohol consumption, we have 8% being considered current drinkers, so using within the past 30 days, with again the highest percentage here definitely being the 17 and older category. And then also similar to the way we ask where youth are getting their electronic vapor products, we also ask where they get their alcohol from. Again, saying someone gave it to them at 35%. But then our second option here is a parent gave it to them at 25%. We also have those buying it with a fake ID, a bar, restaurant, or club, older friends or siblings buying them the alcohol, just to name a few. We did see declines across the board within our comparisons when comparing to previous Delaware County data. So for those who ever drank alcohol, those who were considered binge drinkers, and current drinkers all had declined since the last 2016-17 assessment. We also had lower percentages across the board comparing to the national data as well. Okay, switching gears to then drug use, we have current marijuana users depicted on the slide, which again, 17 and older population had the highest percentage here at 12%. No difference here between gender. And then we do list out some different substances here that youth were under the influence of on school property. So e-cigarettes were the top response, as well as marijuana. And then the rest of the options here were either at 1% or below 1%. Our drug use comparisons are shown here on this slide. The majority of indicators definitely being similar to the last Delaware County Health Assessment. And actually all indicators here were lower than the national percentages when we're looking specifically at high schoolers, especially marijuana use. You can see 15% of Delaware County high schoolers were using within their lifetime. And then we had 36% in the US report using marijuana. Okay, so moving into the sexual behavior section, most of the questions were actually only asked to high schoolers within the county. This specific slide, we did have breakdowns of high school and middle school youth, but then the remaining ones will specifically be high schoolers within the county. The orange bar is all youth when you are looking at breakdowns of those sexting, viewing pornography, or engaging in physical activity. And then our green bar is showing our high school youth, which is definitely higher across the board when comparing to our 6th through 12th grader population. Again, this question was only asked to high schoolers within the county of those who had had sexual intercourse in their lifetime. Again, 17 and older, you will see much higher percentages here. Not too much of a difference here between gender at 17 and 18%. We do have a lower percentage here of youth reporting they had sexual intercourse since the last assessment, but only a few percentage points. But our overall percentage is much lower than our US data, which is at 40% of youth ever having sexual intercourse in their lifetime. You can also see a higher percentage using different birth control methods. So we have an IUD, birth control pills, we have shot, patch, or birth control rings as well. And we saw a little bit of a decline here as well for those using alcohol or drugs before their last sexual intercourse. Okay, so for our mental health section, we have similar questions as what we covered in the adult portion of the assessment. So we have suicide contemplation on this slide, and then the next slide, we will look at those who actually attempted suicide. You can see some large differences here between males and females, with 14% of females considering suicide. And then you'll see a slight decline as you go through those age groups from 13 to 17 and older. And then similar to the last slide, we'll see some similarities here with females being the highest at 5% attempting suicide within the past year. And then our 13 or younger population was slightly smaller here than 14 to 16 and then 17 and older. The different things that were causing youth anxiety, stress, or depression is listed within this slide. By far, the top response here was academic success, with more than 50% saying that this caused them anxiety, stress, or depression. We also have self-image, peer pressure, social media, the current news or political environment, all as options here of what may have caused youth stress, anxiety, or depression. When asked what would keep youth from seeking help, most were worried what others will think of them at 25%. 12% said they had no time. We had youth saying they did not know where to get help. You'll also see family or friends not supporting them, as well as transportation options. As I mentioned previously, we did have the adult adverse childhood experiences that I mentioned. This is the youth version of the ACEs, with parents becoming separated or were divorced being the top adverse experience. And then we'll also see those living with someone who is depressed, mentally ill, or suicidal, which, as you remember, was the top option for that adult portion for the ACEs. We actually do have comparison data for our youth population for mental health. I know I mentioned we didn't for the adults, but we do for the youth portion. Suicide attempts were 1% lower for high schoolers this round compared to 2016. And then we did see increases for both the middle school and high school population here for those feeling sad or hopeless within the past year. You will see higher percentages here for the US when compared to Delaware County high schoolers across the board for every indicator here. Okay, so we are on the last few sections of the youth data, which is covering youth safety, and then we'll look at some violence indicators. On this slide, we specifically have middle schoolers with 73% reporting they always wore a seatbelt and 3% saying they never use a seatbelt. And then for our violence section, we do have a lot of data covering bullying within this section. And different types of bullying experiences. This is our overall percentage, with females having the highest percentage reporting being bullied within the past year. You'll also see a decline as you get older from 13 to 17-year-olds. And then we did see a big decline in high schoolers carrying a weapon in the past month, from 7% in 2016 to now 3%. And then, as you can see, that overall US number is significantly higher here at 16%. Overall, I would say pretty similar percentages as your last assessment for many of the violence-related behaviors. For example, like being threatened or not going to school because they felt unsafe. That did not change since your last 2016 assessment. And then our last slide for violence-related behaviors, we have both physical dating violence as well as sexual violence here. with lower percentages here compared to the US, and then pretty similar responses here when comparing to the 2016 assessment as well. Okay, so to wrap up the youth data, we have one more slide after this. We do have information covering social conditions. First looking at sleep, and then we have some concussion data as well as food insecurity. When you're looking at concussions, that is specifically from playing a sport or being physically active. And then relating to food insecurity at the bottom, 9% said it was sometimes or often true that someone in their family had worried they would run out of food before they had a chance to buy more. And then before I move on to covering an overview of the child health and the actual full report, we do have some additional data regarding perceptions. So specifically, this slide is looking at their friends' perceptions, but we do have some peer and then parent perceptions for some information as well. So you can see on the top left how this was worded. As would your friends feel, it would be very wrong for you to do any of the following. So the highest perception here of their friends' disapproval would be within that prescription drug category. So 73% reported their friends would feel it was very wrong for them to misuse prescription drugs. And then the lowest percentage here is in the alcohol category. So 65% believed their friends would feel it was very wrong for them to have 1 or 2 drinks of an alcoholic beverage nearly every day. And we do have those comparisons between gender as age within these tables as well. Okay, I will stop again, give some time for a breather there. Any questions before moving on to the child-specific portion, and then we will be finished with our data overview today.
I just wanted to share, since Emily touched upon our youth risk behavior survey that was done in 1920 school year. That is because we do reach a large number of kids. Typically, when we do that survey every 3 years, we always do kind of a separate report for that particular population. And as far as our 2022 CHA goes, it is going to be that full report for youth is going to be wrapped in as an appendix. So if you are an entity or an agency that really wants to hone in on that youth 6th through 12th, you can find that separate report encompassed into our full CHA. And I'll go over when Emily's done where to find all this data. Are there any questions about the youth? The reason we put this in today's presentation is prior to that, little bug that kept us all inside for way too long. We were actually scheduled to provide this information to the community in March of 2019, prior to that pandemic taking off across the state. So we thought it was important to share that today. And we are looking forward to working with our school partners again and collecting more data in the future. All right, Miss Emily, back to you.
Okay, wonderful. Okay, so the last section, as I mentioned, we'll be covering child health. And just as a quick reminder, this is reported by parents of those ages 0 to 11 years old. So all of the data that I will report out within these sections are for the full 0 to 11 population. But then as you can see on your slide, we do have specific sections covering only 0 to 5-year-olds and 6 to 11-year-olds. When I do go over some of our comparison data, like I have with the adult and youth populations, we do have a breakdown of 0 to 5, and then the 6 to 11-year-olds. So you can see for some of our main indicators, how that may change from both of those populations. Okay, so again, starting with BMI classifications here, we had 13% of children being considered obese by BMI. And we do have parents who rate their child's overall health. So 98% said their child's health was excellent or very good. And then we have some conditions listed at the bottom of your slide of conditions they were actually diagnosed with. So the top being anxiety problems at 11%. You'll also see ADD, asthma, as well as head injuries and depression. All right, those diagnosed with asthma increased for our 0 to 5-year-old population. So we do have that bold black line to try to differentiate here of where you can find the 0 to 5 and 6 to 11 information. And then Delaware County had a higher percentage of parents rating their children's health as excellent or very good when comparing to both Ohio as well as US data. So on that right-hand side, for the 6 to 11-year-olds, we can see 98% reporting their health as excellent or very good. And then we had 87% in Ohio. Under healthcare access, we had 89% of parents reporting their child had a personal doctor or nurse. And then we had reasons why their child did not get all of the medical care that they may have needed. And this is within the past year. Cost was the main barrier here. Of those 6%, cost was the top response. Inconvenient times or too long of a wait for an appointment, as well as treatment is ongoing. We do have some vaccination data as well within the full child report. On this slide, we're looking at why parents said that they did not get all of the recommended vaccinations. The top response was they had received some, but maybe not all. Parents chose just not to vaccinate their child, and then an alternate vaccination schedule was being used. For our comparisons, you can see those who had public insurance significantly here lower than the state and national data. Delaware County was also about 10% higher here than the state for those having a personal doctor or nurse. And then those seeking mental health treatment declined slightly for the 6 to 11-year-old population in Delaware County than the previous 2017 data. The next two slides, we will just cover briefly the 0 to 5-year-old population. So parents reported putting their 0 to 5-year-old to sleep mostly on their back with 92%. So that's definitely highest there. And then the other options here included stomach on their side, and then maybe they did not know. Reading to their child was also an important indicator that we wanted to report out here. We do have national comparisons for family members reading to their child every day in the past week, with Delaware County's percentage being significantly higher than both Ohio and the US. We did see a slight decline since 2017, but again, much higher here than our national comparisons. And then before moving on to middle childhood, we do have a question regarding what mothers did during their last pregnancy. So getting prenatal care within the first 3 months was at 88%. We also have mothers who experienced depression during or after pregnancy at about a third. Additionally, at the bottom of the slide, a new question asking about e-cigarettes and vapes around their child with only 1%. For our middle childhood data, you can see at the top of your slide, this is 6 to 11-year-olds. We're covering physical activity on this slide, with 82% reporting their child played a sport or participated in physical activity for 60 minutes on 3 or more days. 2% reported no physical activity in the past week, which again was significantly lower here than both Ohio and the US. No changes here since your last assessment in 2017. Our last slide is covering middle childhood, touches on different forms of bullying. Overall, we had 34% of parents reporting their child was bullied. And then you'll see the different types of bullying that was reported. So all of those within the parentheses, we had some definitions on the survey so they could differentiate the different types of bullying with verbally as our top response. We also have physical, indirect, and then electronic bullying at the bottom of the slide. Unfortunately, we do not have comparison data here for the Ohio and US areas, but we do have from your previous 2017 Shaw, bullying declining from 43 to 34% in 2021. You will see a little spike here in social media accounts since 2017 for 6 to 11-year-olds. As you can see now, this is our last portion of the adverse childhood experience data. Again, as mentioned, across every population. The questions are slightly different for the child population, but divorce and separation was the top response here, just like we had within the youth population. We also have those living with someone mentally ill or suicidal, again, making it within at least those top 3 responses across every population. Okay, so our last section, this slide will wrap up our presentation today, is family and community characteristics. Families were eating an average of 5.4 times together per week. As you'll see in our comparison table, we do have a lower percentage in Delaware County for those 6 to 11 eating a meal together compared to the state or the nation, but it did actually increase since your last assessment. And then the highest percentage for sleep on an average weeknight was 10 hours at 31% of the population here. You'll also see comparisons for our ACE data. We do have national and Ohio data here to compare to, which is significantly higher for both Ohio and the US. So as you can see, 3% overall for 6 to 11-year-olds, and then Ohio, we have 25% experiencing 2 or more of all of those different adverse experiences. Okay, so I know that was a lot, but thank you so much for bearing with us and reviewing all of those sections today within the report. I'd be happy to answer any questions, or if you think of something as you leave today, feel free to reach out via email. We do also have a participant feedback link that I will share on the next slide to gather information from you all. We'd appreciate any feedback so we can incorporate it into the full report or potentially the next report, and we'll absolutely take that into consideration. So thank you again. I appreciate you all having me today. If there's any questions, I would be happy to answer.
Yes, Sheila.
Sheila, just a quick question. Demographic information at the very beginning where you showed the demographics of who responded, are we also going to have a slide or a page that shows the actual demographics of the county, compare like who we got and actually what we looked like?
Yep, sorry. Did you hear that, Emily?
Yes, I did.
Yeah.
We
Oh, okay.
actually have the full demographic information within the appendix of the report. So you can look at breakdowns of the actual survey respondents, and then it also compares it to Delaware County census information, as well as where Ohio is for different demographic categories. Something we also incorporated this round was to look at how Delaware County has changed throughout the past couple census data releases. So we do have some race, ethnicity, income, age, all of that information within the appendix of the full report. Great question.
Thanks, that's what I was looking for.
Perfect.
Did that demographic information possibly include sexual orientation, gender identity?
You know, we do have, I believe, information within the youth demographic category for the actual respondents within the county, but I do not believe off the top of my head that we include that from the census level information. I don't believe we're able to gather that information, but I can absolutely look a little bit further into that to be sure.
Is it marked up, right?
Yes.
Yeah, we can follow up on that for sure.
So when the participants are in Delaware County, like actually having.
Could you hear that, Emily?
Oh, no, I did not hear that. Sorry.
The question was about the, like, will we know where participants from Ashley, how many of those answered, broken up by the different townships or districts?
Okay, absolutely. So we actually break down the data within the report by school district. So the adult portion, the youth and the child, you'll see within prior to the full sections, a breakdown by school district. That is the only way that we have that reported out within the full report. But as Kelsey mentioned earlier, it is awesome to see how many respondents completed the surveys across the board. So typically our statistician would want to see at least 50 responses before breaking that data down any further. But if there's a high enough response, we can always do additional correlations there if there's something that you're interested in.
That leads me right into my point that I wanted to touch upon again. We know there's a lot of data that was shared here today, and this, believe it or not, was just a glimpse. It's probably, how many pages is the report, Emily?
Over 200.
It's over 200 pages. So as I mentioned, we do have a community health epidemiologist, Emily. Stand up and wave so everybody can see you. We do have a epidemiologist on staff with us that Emily will be sharing the raw data with the health district, where we will be able to dive down a little bit more into any particular data point or indicator that our partners might enjoy or want for their work in their agencies. So if you have that need, please don't hesitate to reach out to me or Haley. I just want to say welcome. There's a lot of new faces here today, and I want to say I am excited that you're here. You're starting with the partnership at a great time because this is a community health assessment cycle that we only do every 5 years. So welcome to those new faces. We hope to see you. Emily, do you want to give a brief overview at all about next steps and what to, as we get closer to that June 9th meeting?
Sorry, I had to unmute myself there. Absolutely. So yes, our first meeting will be in June regarding our community health improvement planning. That is going to be me coming in virtual again. Our first meeting will focus on selecting priorities for the next cycle. So there will be some information coming. I'm not sure if that's specifically coming from Kelsey, but I believe so, that we will send to her to send out to all of you to prepare for that first meeting. So we're specifically going to ask you to dive further into that report and report out on the top key issues from your organization standpoint, where we can then take all of that data and then really focus within that first meeting to set those priorities over this next community health improvement cycle. I will be covering a lot within that first meeting regarding what to expect within the next few meetings. We also will be talking a lot about alignment with the state health improvement plan and just kind of looking at an overview of what to expect, touching on your priorities from the last round, and then really seeing where we're going to be moving for this cycle. So more information to come. We'll be sending out that homework to the health district so they can send that out to the full group that will be participating.
So the major takeaway is June 9th from 9 to 11:30. You should have already received a calendar invite from Haley about that meeting. And as Haley mentioned in her presentation, you will be asked to participate in some pre-homework ahead of that meeting. And if I'm understanding Emily's process correctly, once you participate in your homework individually back at your own desks or offices or agencies, then when we come together, Emily will be presenting, kind of all of the information together. So please make sure that you allow yourself the time and energy and focus to participate in those homework assignments, because as she said, that is going to be our next step to choose our next priority areas. And then along that same line, because this is the same, this is a different way that we've typically chosen health priorities. I know I saw Amy Hawthorne here earlier, so I'm going to pick on the mental health board because I don't know where Amy is off here. We have two folks here today from the mental health board, and the reason I'm bringing this up as an example is when we get into the CHIP and we get into the strategy work, we have many people that represent one agency. However, when it comes to creating or choosing those health priorities, and I see Farah shaking her head because she's the same way. She has several staff that work in the strategy areas of the CHIP. However, when it comes to selecting health priorities as a member of the partnership, we would encourage you to work within your own agency to make sure that Source Point, the mental health board, Helpline, all the people that have more than one member working in this area, we don't want to give more votes to one agency over another. So when it comes to choosing those priorities, and I can use the health district as an example, you'll see many faces here today from the health district. We don't all get to vote on those health priorities. As our health commissioner, Sheila is the person that will, as our health commissioner, choose what the health priority is. So we encourage you, as we get those links sent out to all of the partnership members, to just make sure that you collaborate amongst yourselves, and again, just create one kind of response to that health priority. Lastly, I'm going to ask Joe to forward me to slide 14. Just a few more things that I want to share. I do want to, since I mentioned the mental health board, I do want to say our appreciation to them for helping us fund this community health assessment. Obviously, you can see a crossover to a lot of the work that the mental health board does in the way of the questions that we ask. So we appreciate your assistance, not only in the health improvement plan, but also helping to fund this comprehensive assessment that we are so lucky to have here in Delaware. So as Emily mentioned,
sorry, just a sec.
It's fine. As Emily mentioned, we are going to be asking for your feedback today. We're going to be asking you to allow yourself some time to deep dive into this. This was just a brief overview. And I'm going to show you here in a second how to get to the report online. But if you're a paper person, you can take this survey on paper. If you visit the registration booth before you leave, you can take the survey via paper. We just ask that you scan it and email it back to us. Or you can scan your QR code using your camera today. It's just a quick 7 or 8 question survey about what surprised you, what you liked, what you didn't like. And this survey is going to be open and available to the public for 2 weeks. So allow yourself some time to dive down a little bit more into that data and give us your feedback. And then last but not least, next slide, where can you find this report? If you go to our website, delawarehealth.org, you'll land on our homepage, first click. Our homepage does have a scroller that kind of rotates through different programs. And our media specialist, Megan, has assured me that even though that is a program focusing on WIC, we do actually have a scroller that will be our community health assessment. So you can either click on that scroller or next click. If you don't happen to see the scroller when you land on the homepage just right, you can go to coalitions at the very top. And if you click on coalitions, you will see what's highlighted there, the partnership. And last click underneath that partnership, on the right-hand side of the partnerships homepage, you will see community health assessment on one of those right-hand side of your screen, one of those toggle buttons. And not only will you see this community health assessment report, but you'll see past health assessment reports as well. And again, that survey link is right there again. So after you deep dive and you take it all in and all your free time, make sure you click that link again to give us your feedback. Last but not least, if any other agencies have any other community health data that you would like to be, that you would like to include in our 2021 community health update, please make sure you send that to either myself or Haley. We can get that incorporated. We will just kind of vote on that final update at our June 9th meeting. We hope to see many of you at the June 9th meeting. We appreciate your time today. Take a bagel, a cup of coffee to go. It just makes our work a little bit lighter when we go back to the office. Any other last thoughts? Farah or Sheila, would you like to say anything?
I just say thanks to everybody who's here this morning. I know this was kind of hard to see. It's always fun to try to find the right venue for all these kinds of things. So thanks to our team for finding this. Hopefully next time we do this, we will be in our new building. But thank you all very much for coming.
Great morning.
If you haven't signed in, please make sure you visit the registration table. I see a few faces with Missy signatures. Yes.